Hi, I am Gilles Sédou and I'm presenting the results of the efficacy of a multi-ingredient vaginal gel in normalizing HPV-dependent cervical lesions and clearance. My conflict of interest disclosure is below. Papillocare is a vaginal gel approved in Europe with the indication of re-epithelialization for the cervical transformation zone for the prevention and co-adjuvant treatment of HPV-induced lesions. This product is not yet approved by the FDA. Papillocare is a patented multi-ingredient vaginal gel which include Coriolis versicolor and other active ingredients. I'm presenting today the results of a multi-center randomized open-label parallel group versus standard of care of two dosing regimen of Papillocare vaginal gel versus a control group for a period of 6 months in 84 unvaccinated HPV-positive women. I'm focusing in this presentation on the primary endpoint as well as one secondary endpoint, while the poster 772, also presented at this meeting, focus on other secondary endpoints and overall tolerability. 84 HPV non-vaccinated women age 30 to 65 years old with a mean age of 41 years old were evaluated in a 3-arm clinical trial, 2 Papillocare arms and the control arm. The first dose regimen of Papillocare in group A was 1 vaginal cannula per day for 21 days for the first months, followed by 1 vaginal cannula a day every other day for 5 months, 21 days a month to exclude menstruation days. The second dose regimen in group B was a vaginal cannula per day for 21 days for 3 months, followed by 1 vaginal cannula a day every other day for another 3 months, again, 21 days a month to exclude menstruation days. The group C received no treatment. This clinical trial has a 6-month follow-up period. The primary endpoint was the percentage of women with normalized cytology with concordant colposcopy at 6 months. Results of the 2 Papillocare dosage regimens were combined for the analysis, as the objective was to measure the efficacy of Papillocare versus the control group. In the Papillocare arm, at 6 months, normal cytology with concordant colposcopy was observed in 85% of the total treated population, in 88% of the broad high-risk population, defined by the presence at baseline of several HPV types, 16 to 68, basically, and in 73% of women with HPV types 16, 18, and 31 considered the most at risk. The 2 first results are statistically significant versus the control arm. The last one was a too small patient group to show a statistical difference, but show a positive trend. We are also presenting a secondary endpoint, which is the HPV clearance at 6 months in a high-risk group of HPV women. The HPV clearance was observed in 63% of women in the Papillocare arm versus 40% of women in the control arm, with a p-value of 0.076. So at the conclusion, after 6 months treatment period, Papillocare vaginal gel has demonstrated a statistically significant efficacy in normalizing HPV-dependent cervical lesions, especially in a high-risk subpopulation, and also revealed a positive trend to increase HPV clearance. Thanks a lot for your attention.